Of all the members in the audience, how many of you are familiar with attention deficit hyperactivity disorder? A few of you? Okay. My name is Duncanson, and as a psychology major, I've observed alarming trends in the overdiagnosis and prescription of ADHD medications, specifically in prepubescent children. Through my research, I've learned a couple things, many of, high concern. I've learned about the potential negative consequences of misdiagnosing and therefore unnecessarily medicating children with ADHD, and the long-term effects that can have, both physical, cognitive, and psychosocially. So for you to gain a better understanding of this issue, we're going to be covering the following three topics: the overdiagnosis of ADHD in children, the subsequent overprescription of medications, specifically stimulant medications like Adderall, and the long-term detrimental effects that I mentioned. To gain a better grasp on this issue, I think it's important that we first gain a foundational understanding of what exactly ADHD is and its diagnostic criteria to see how it goes misdiagnosed or overdiagnosed, if you will. So first and foremost, the diagnostic criteria for ADHD combined type, which is the most common type. There's multiple kinds, which is it's a type of disorder that basically has a couple aspects of the different types together in a nutshell. So the DSM-5, the primary piece of literature used by clinical psychologists for diagnostic purposes, includes inattention, hyperactivity, and impulsivity. And these are all symptoms that should be observed for a period of 6 months or longer to have a case for making that diagnosis. Now, as I'm sure you're all aware, often children are, hyperactive as is, and high energy, and can be a little impulsive at times. So sometimes this normal childhood behavior is mistaken for ADHD, as this behavior can be explained rather than this disorder. It can be explained by the frontal lobe being far from developed at this point in their lives, which can contribute to impulsive and seemingly inattentive behavioral patterns. There's also a couple other factors contributing to overdiagnosis, especially in school-age children, which include pressure on teachers and the education system in general to identify and address behavioral issues to remedy them. The cultural and social expectations for children's behavior to be within a certain margin, and a lack of standardized diagnostic procedures for first, determining if a child should even be screened by a psychiatrist at all. Now that we've gained a basic understanding of ADHD in general, and its implications and its procedures for diagnosis, it's important we explore the consequences of overprescription of stimulant medications, in particular with medications like Adderall and its effects on these children. So essentially, Adderall is a stimulant class drug, which essentially means that it increases levels of norepinephrine and dopamine in the brain, which are neurotransmitters that are highly important for cognitive functions like paying attention, and tasks that require extended periods of focused effort. Now, Adderall is the most common type of stimulant drug used to treat ADHD, and as such, it's prescribed most often. And recently, in the last couple of decades, there's been increasing prevalence in pediatric prescriptions, especially as it stands today. So some reasons for overprescription include, as I mentioned before, pressure placed on the parents by not just the education system, but parents to try and get their children to behave a specific way, and therefore they're pressured into a spot which motivates them to find a quick and easy solution to yield the obedience that they're looking for, rather than actually trying to find the root cause of the problem to maybe have a more holistic approach to the situation. Also, there's a very traditional system for trying to get children to obey the social expectations placed on them in, social settings by peers and educators alike. And as a result, there's a lacking in alternative interventions and support systems other than the traditional ones for children to develop and learn and grow and develop in a more natural way rather than being treated with stimulant medication. However, with this in mind, it's important that we ask the question, what are the possible long-term effects of misdiagnosis and overprescription on these children? So there's a variety of detrimental effects that can be acquired from, being exposed to these psychoactive drugs long-term. So there's multiple physical health consequences that can be experienced later on in life, but a prevalent one is increased blood pressure and cardiac problems in adulthood because of the stimulant nature of the drug. It can eventually cause problems with the electrical conduction of the heart and nervous system in that respect. Also, because it changes brain chemistry, and brain chemistry is extremely important for sleep and general recovery of the mind, people that take these drugs for extended periods of time can experience sleep disturbances. Additionally, they can experience appetite suppression and, as a result, potential growth issues because they're not getting the nutrients they need to grow and develop physically. There's also psychological and emotional impacts, as it's been noted by researchers that there's an increased risk of anxiety and depression, and there's negative effects on self-esteem and identity development as a whole. Moreover, there's an increased risk for potential substance abuse down the line in adulthood. Considering all this information, it's imperative to be aware of the potential harm caused by, overzealously diagnosing and overprescribing ADHD medications in children. The overdiagnosis and prescription of ADHD medications, such as Adderall, can have serious consequences on the well-being of children in multiple areas of development. I hope you now have a better understanding of the issues surrounding ADHD diagnosis and medication in children. Overall, I believe it's our responsibility as current and future guardians of generations of children to advocate for more accurate diagnostic processes and comprehensive support systems for all children, regardless of whether or not they fit the behavioral mold that we've socially constructed. Thank you.